For 10 years, night shift nurse Sarah Collins walked the same hospital corridors, checking on the same patients, following the same routines. But every night, without fail, she would pause outside room 237, not because of any medical emergency, but because of the man inside who never slept, never complained, and never had a single visitor in a decade. What Sarah didn't know was that this mysterious patient had been waiting all those years for the right moment to share a secret that would shatter everything she believed about compassion, sacrifice, and the invisible connections that bind us together. Because the man in room 237 wasn't just any patient. He was a patient who had been admitted to the hospital on the exact same night Sarah started her first shift as a nurse. For 10 years, they had shared the same schedule, the same building, the same quiet hours between midnight and dawn, but only one of them knew that their connection ran deeper than professional duty. The fluorescent lights of St. Mary's Hospital hummed their familiar tune as Sarah Collins pushed through the main entrance at 10:45 p.m., 15 minutes early for her shift, as she had been every night for the past 10 years. At 34, Sarah had the kind of quiet confidence that comes from a decade of navigating medical emergencies in the small hours when the world sleeps and hospitals become islands of vigilant care. The night shift at St. Mary's was Sarah's domain. She knew every creaking floorboard on the third floor, every temperamental piece of equipment in the supply closets, and every patient who had been there long enough to become part of the hospital's permanent landscape. But none of them intrigued her quite like the man in room 237. "Evening, Sarah," called Janet, the day shift supervisor, as she gathered her things from the nurse's station. "How was your weekend?" "Quiet, which is exactly how I like it," Sarah replied, tying her shoulder-length brown hair back into the practical ponytail that had become her trademark. "How's our long-term resident in 237? Janet paused in her packing, a slight frown crossing her weathered face. "Same as always. Vital stable, medications on schedule, but..." She trailed off, shaking her head. "But what?" "I've been working here for 22 years, Sarah. I've seen patients who stayed for months, even years, but I've never seen anyone quite like Mr. Chen. It's like he's waiting for something, but I can't figure out what." Sarah nodded, understanding exactly what Janet meant. David Chen, the man in room 237, was medically stable, had been for years. His condition, a combination of mobility issues and chronic pain following a severe car accident, required ongoing care but wasn't life-threatening. What made him unusual wasn't his medical needs, but his behavior. In 10 years, Sarah had never seen him sleep during her shifts. He would lie quietly in bed, sometimes reading, sometimes staring out the window, but always alert, always watching. "Did his social worker ever make any progress finding family members?" Sarah asked, though she already knew the answer. "Nothing. It's like he appeared out of thin air that night 10 years ago. No emergency contacts, no family, no friends. Just a man with enough insurance to cover long-term care and apparently nowhere else to go." Sarah had heard this story countless times, but it never stopped puzzling her. In her experience, everyone had someone. Even the most isolated patients usually had a distant relative, an old friend, or at least a neighbor who checked on them. But David Chen seemed to exist in complete solitude, maintained by the hospital staff and visited only by the occasional doctor or social worker making their required rounds. As Janet left for the day, Sarah began her nightly routine. She checked the assignment board, noting which patients would need extra attention during her shift. Room 201, elderly woman recovering from hip surgery. Room 215, middle-aged man with pneumonia. Room 223, young mother monitoring a high-risk pregnancy. And room 237, David Chen, the permanent resident who had become as much a part of the night shift as the vending machines in the break room. Sarah made her first rounds at 11:30 p.m., moving quietly through the dimmed corridors with practiced efficiency. Most patients were sleeping, their rooms lit only by the soft glow of monitoring equipment. But as she approached room 237, she could see the familiar silhouette of David Chen sitting upright in bed, backlit by the reading light above his headboard. "Good evening, Mr. Chen," Sarah said softly as she entered the room. "How are you feeling tonight?" David Chen was a man in his early 60s, with silver hair that had grown longer during his hospital stay, and kind eyes that seemed to hold more stories than he ever shared. Despite a decade of immobility, he maintained a dignified bearing that suggested he had once been someone of importance, though his file contained no clues about his previous life. "Good evening, Nurse Sarah," he replied, using the formal address he had maintained throughout their 10-year acquaintance. "I'm well, thank you. Just doing some reading." Sarah checked his chart, noting his vital signs and medication schedule. Everything was exactly as it should be, as it had been every night for 10 years. But tonight, something felt different. There was an energy in the room, a subtle tension that made Sarah pause in her routine. "Mr. Chen," she said, setting down his chart, "can I ask you something?" "Of course. In all the time I've been your nurse, I've never seen you sleep during the night shift. Do you have trouble sleeping, or do you just prefer to be awake at night?" David smiled, and Sarah noticed that his expression held something she hadn't seen before. Anticipation, perhaps, or the look of someone who had been waiting for exactly this question. "I suppose you could say I'm waiting for the right time to sleep," he said cryptically. "The right time? Some things are worth staying awake for, Nurse Sarah. Some moments you don't want to miss." Before Sarah could ask what he meant, her pager buzzed with an alert from room 215. She excused herself, promising to return later, but the conversation stayed with her as she attended to the pneumonia patient who was experiencing breathing difficulties. It wasn't until 2 a.m., during the quietest part of her shift, that Sarah found herself thinking about David Chen's words. She had been working at St. Mary's for exactly 10 years as of tonight, an anniversary she hadn't mentioned to anyone but had been quietly acknowledging to herself. Was it possible that David somehow knew about her work anniversary? But how could he, and why would it matter to him? Sarah found herself walking back to room 237, drawn by a curiosity she couldn't quite explain. The door was slightly ajar, and she could see David sitting in the same position as before, but now he was looking directly at the doorway as if he had been expecting her return. "Couldn't sleep either?" he asked with a gentle smile. Sarah stepped into the room, feeling suddenly like she was crossing some invisible threshold. "Mr. Chen, can I ask you something else?" "I've been hoping you would. How long have you been awake tonight? Really awake, I mean, not just resting with your eyes open." David's smile deepened. "About 10 years, 3 months, and 14 days. The answer hit Sarah like a physical blow. 10 years, 3 months, and 14 days ago was the exact date she had started working at St. Mary's. It was the night she had begun her career as a night shift nurse, full of nervous energy and determination to make a difference in people's lives. That's very specific," Sarah managed to say, though her voice sounded strange to her own ears. "Some dates are worth remembering, Nurse Sarah, especially when they mark the beginning of something important." Sarah felt her heart racing. "Mr. Chen, I don't understand. Are you saying you've been keeping track of how long I've worked here?" "I'm saying," David replied, his voice taking on a weight it had never carried before, "that I've been waiting 10 years to have this conversation with you. And now that you're ready to hear it, I think it's time you knew why I've really been here all this time." Sarah sank into the visitor's chair beside David's bed, her mind reeling from the implications of what he had just said. In 10 years of nursing, she had encountered patients who formed attachments to their caregivers, but nothing like this. The precision of his answer, the way he had been expecting her questions, the sense that he had been orchestrating this moment, it all suggested something far more complex than a simple patient-nurse relationship. "Mr. Chen," Sarah said slowly, "I think you need to explain what you mean. How can you have been waiting for this conversation? And why tonight specifically?" David reached for something on his bedside table, a manila folder that Sarah had never noticed before, though she had been in this room thousands of times over the past decade. "Before I answer your questions, I need you to understand something about the night you started working here. Do you remember October 15th, 2013? Sarah nodded. "Of course. It was my first night as a registered nurse. I was terrified I'd make a mistake, but I was also excited to finally be doing what I'd trained for." "What time did your shift start that night?" 11 p.m. I remember because I arrived early, just like I always do. "And do you remember what time I was admitted to the hospital that same night?" Sarah frowned, trying to recall. Patient admissions weren't typically something night shift nurses handled, That was usually day shift territory. But now that David mentioned it, she did have a vague memory of an emergency admission that had come in late, well after her shift had begun. "I remember there was an emergency case that came in around midnight," she said slowly. "A car accident victim, but I wasn't assigned to that patient initially." "No," David agreed. "You weren't assigned to me until the following night after I had been moved to room 237. But you were working that first night when I arrived, and you were part of the team that helped stabilize me in the emergency room." A memory flickered in Sarah's mind. A chaotic scene in the ER. A man unconscious from severe injuries. Blood, urgency, the controlled panic of trauma medicine. She remembered helping the doctors, following orders, doing whatever was needed to save a life. But there had been so many emergency cases over the years that individual faces tended to blur together unless something extraordinary happened. "I don't remember you specifically," Sarah admitted. "That night was overwhelming. There was so much to learn, so much happening. But I remember you," David said quietly. "I remember your voice cutting through the chaos. I remember you staying calm when everyone else was shouting. I remember you holding my hand when the doctors were working on me, even though you probably thought I was unconscious." Sarah's breath caught in her throat. She did remember holding a patient's hand that night. It was something she had done instinctively, a gesture of comfort that had felt natural even in her nervousness. But she had no memory of the patient's face, only the feeling that someone needed reassurance in a moment of terror. "You were conscious?" she asked. "In and out, but conscious enough to hear your voice, to feel your presence. Do you know what you said to me?" Sarah shook her head. "You said, 'You're going to be okay. I'm going to stay with you until you are.' And then you did exactly that. Even after your shift ended, you stayed until the day shift nurse arrived to take over my care." The memory came flooding back suddenly, sharp and clear. Sarah remembered now. She had stayed late that first morning, unable to leave until she knew the accident victim was stable. It had been an impulsive decision, driven by a sense of responsibility she couldn't quite explain. Her supervisor had praised her dedication, but Sarah had always thought of it as simply doing what felt right. "I stayed because I was worried about you," Sarah said. "It was my first night and I felt responsible somehow." "You stayed," David said, opening the manila folder, "because you have a gift for seeing people who need to be seen. And that night, I needed to be seen more than I had ever needed anything in my life." From the folder, David extracted a thick stack of papers, documents, photographs, and what looked like newspaper clippings. Sarah recognized some of the items as copies of medical records, but there were other things too. Articles that appeared to have been cut from local newspapers, printed emails, and handwritten notes in David's careful script. 10 years ago, David began, I was a different man. I had a successful career as an engineer, a beautiful home, and a life that looked perfect from the outside. But I had been struggling with depression for years, and on the night of October 15th, 2013, I had made a decision that I thought would end my suffering permanently. Sarah's heart sank as she began to understand what David was telling her. The car accident wasn't an accident, she said quietly. No, I had planned it carefully, chosen a route where I wouldn't endanger anyone else, timed it for late at night when the roads would be empty. I wanted to die, Sarah. I had given up on everything and everyone, including myself. David's voice remained steady as he continued, but Sarah could see the emotion in his eyes as he relived that night. But when I woke up in that emergency room, the first thing I heard was your voice telling me I was going to be okay. The first thing I felt was your hand in mine, and for the first time in months, I felt like someone actually cared whether I lived or died. Sarah felt tears welling up in her eyes as the full weight of David's revelation settled over her. Mr. Chen, please, let me finish. I need you to understand why I've been here for 10 years, why I've never slept during your shifts, why I've been waiting for tonight. David pulled out a newspaper clipping dated several months after his accident. The headline read, Local Engineers Recovery Inspires Hospital Staff. Below it was a small photograph of David in his hospital bed, surrounded by several nurses and doctors. Sarah was clearly visible in the background, though she had no memory of the photograph being taken. This article was published 6 months after my accident. The hospital's public relations department featured my recovery as a success story, a man who had been given a second chance at life. But what they didn't know, what nobody knew except you and me, was that my recovery wasn't just physical. It was spiritual, emotional, psychological, and it all started with a young nurse who showed me kindness when I needed it most. Sarah studied the photograph, remembering now the day it had been taken. The hospital had been showcasing their trauma recovery program, and David had been selected as an example of successful long-term care, but she had never seen the finished article. After that article was published, David continued, something extraordinary happened. I started receiving letters from people who had read my story, people who were struggling with depression, who had lost hope, who were considering ending their own lives. They wrote to me because they had seen in my story a possibility that things could get better. From the folder, David extracted a thick stack of letters, dozens of them, all addressed to him at the hospital. Sarah could see return addresses from across the country, different handwritings, different types of paper, but all sharing the common thread of desperation, seeking hope. I realized that I had been given not just a second chance at life, but a purpose. These people needed to know that recovery was possible, that darkness could give way to light, that someone cared about their survival. So I started writing back to them. David showed Sarah several copies of letters he had written, long, thoughtful responses to strangers who had reached out to him in their darkest moments. His handwriting was careful and clear, his words chosen with the precision of someone who understood the power of hope. But here's what I discovered, Sarah. I couldn't help these people find their way back to life unless I had truly found my way back myself. And every night as I watched you care for patients with the same compassion you had shown me, I realized that you were the reason I had been able to find that path. Sarah was crying openly now, understanding for the first time the full impact of that night 10 years ago. You stayed here because of me. I stayed here because of what you represent. Every night I've watched you treat patients not just as medical cases, but as human beings who deserve dignity and care. I've seen you stay late to comfort someone who was afraid. I've watched you celebrate with families when good news came. I've observed you grieve when you couldn't save someone. David reached for the last item in his folder, a thick journal bound in leather. For 10 years, I've been documenting every act of kindness I've witnessed you perform, every time you went beyond your job requirements to help someone, every moment when you chose compassion over convenience. He opened the journal, revealing pages covered in his neat handwriting. Sarah could see dates, times, and detailed descriptions of interactions she had with patients over the years. Some of the entries she remembered clearly, others had been forgotten in the routine of daily nursing care. Why? Sarah whispered. Why have you been keeping track of all this? Because I've been writing letters to people in crisis all over the country, and in every letter, I've been telling them about you. Not by name, of course, but I've been describing what real compassion looks like. I've been using your example to show them that there are people in the world who care about strangers, who choose kindness every day, who see the humanity in everyone they encounter. David pulled out one more item, a thick folder containing copies of hundreds of letters he had sent over the past decade. Sarah could see addresses from dozens of states, letters going to hospitals, crisis centers, and individuals who had reached out to him for help. Sarah, in the past 10 years, I've corresponded with over 500 people who were contemplating suicide. I've been able to help 127 of them find professional help and support systems. 43 of them have written to me to say that they've found reasons to keep living. 18 have gone on to become volunteers at crisis centers in their own communities. The numbers were staggering. Sarah tried to process what David was telling her, that her simple act of kindness on her first night as a nurse had somehow rippled outward to touch hundreds of lives across the country. I don't understand, she said. How did my work here help you counsel people I've never met? Because you showed me what love in action looks like. Every night for 10 years, you've demonstrated that it's possible to care about people you barely know, to show up consistently for others regardless of your own circumstances, to find meaning and service to others. When people write to me asking if life is worth living, I tell them about a nurse who holds patients' hands during procedures, who remembers their birthdays, who treats every person with the same respect, regardless of their background or condition. David smiled through his own tears. I tell them about someone who proves night after night that there are people in the world worth living for. People who will show up, who will care, who will see their humanity, even when they can't see it themselves. Sarah sat in stunned silence as David continued pulling items from his collection, a decade's worth of correspondence that painted a picture she had never imagined. The leather journal was only the beginning. There were files organized by year, boxes of letters from people across the country, and detailed records of follow-up correspondence that had continued for months or even years with individuals who had initially contacted him in crisis. Mr. Chen, Sarah finally managed to say, are you telling me that you've been running some kind of informal suicide prevention service from your hospital bed? With the full knowledge and support of the hospital administration, David confirmed. About 3 years ago, Dr. Martinez in the psychiatry department learned about what I was doing and helped me formalize the program. St. Mary's now officially supports the letter-writing initiative, and they've even provided me with resources to help people connect with local mental health services. David opened another folder, this one containing official hospital letterhead and documentation of the program that had grown from his bedside correspondence. Sarah could see reports tracking outcomes, testimonials from people who had been helped, and even academic papers that had been written about the innovative approach to crisis intervention. The hospital has been amazing, David continued. They've given me access to their database of mental health resources across the country. They've trained me in crisis intervention techniques. They've even hired a part-time assistant to help me manage the correspondence when the volume became too much for me to handle alone. Sarah shook her head in amazement. I had no idea any of this was happening. How is it possible that I've been your nurse for 10 years and never knew about this? Because most of the correspondence happens during the day when you're sleeping, and because I wanted to make sure I could tell you about it in the right way, at the right time. Which is tonight? Which is tonight, David confirmed. Your 10-year anniversary as a night shift nurse. The night I've been waiting for since I realized what I wanted to do with the rest of my life. David reached for one more item, an envelope addressed to Sarah in his familiar handwriting. I've written thousands of letters over the past 10 years, but this is the most important one I've ever written. It's for you. Sarah's hands trembled as she accepted the envelope. Inside was a single sheet of paper covered in David's careful script. Dear Nurse Sarah, 10 years ago tonight, you saved my life, not just by helping the doctors treat my injuries, but by showing me that there were people in the world who cared about strangers, who chose kindness as their default response to human suffering, who saw dignity in every person they encountered. I want you to know that your act of compassion on that October night has traveled far beyond room 237. It has reached a mother in Oregon who decided not to take her own life after reading about your dedication to caring for others. It has touched a veteran in Texas who found hope in knowing that somewhere in the world, a nurse was holding patients' hands during difficult moments. It has inspired a teenager in New York who learned that there are adults who see value in every human life, regardless of circumstances. You have been the center of a web of healing that extends across the country. Every act of kindness you've performed in this hospital has been documented, shared, and used to remind people in crisis that compassion exists in the world. You are the proof I offer to desperate people that life is worth living, that there are individuals worth trusting, that humanity has representatives who choose love over indifference. But tonight, after 10 years of watching you work and 10 years of sharing your example with others, I want to tell you something that I hope will change your life the way you changed mine. You don't have to carry the weight of caring alone anymore. The program that began with my letters has grown into something much larger. St. Mary's Hospital has approved the establishment of the Sarah Collins Center for Compassionate Care, a formal program that will train healthcare workers in the kind of patient-centered approach you've been modeling for the past decade. The center will be funded by donations from the hundreds of people whose lives have been touched by your example, and it will be directed by someone who understands compassion not as a concept, but as a practice. Sarah, I'm asking you to consider taking on this role. to step away from the night shift and into a position where you can teach others what you've taught me about the healing power of human connection, to let your influence expand beyond these corridors to hospitals across the region and eventually across the country. You've spent 10 years taking care of others. Now I want to offer you the opportunity to let others take care of you, while you share your gifts on a larger scale. The choice is yours, but I hope you'll say yes, not just for the people who will benefit from your teaching, but for yourself. You deserve to see the full impact of the kindness you've been spreading. You deserve to know how many lives you've touched. You deserve to have your own life changed by the good you've done. With profound gratitude and deep respect, David Chen, your patient in room 237. Sarah read the letter 3 times before she fully processed what David was offering her. A center named after her, a position that would allow her to influence healthcare on a much broader scale. Recognition for work she had never realized was being noticed. "David," she said, using his first name for the first time in 10 years. "I don't know what to say." "Say you'll consider it. Say you'll let me introduce you to the people whose lives you've touched. Say you'll allow yourself to see the difference you've been making." David reached for his phone, a device Sarah had never seen him use during her night shifts, though she now realized he probably did most of his correspondence during the day. He scrolled through his contacts and showed her a list that seemed to go on forever. Names, phone numbers, and email addresses from across the country. These are people who have asked to speak with you if you were ever willing. People who want to thank you personally for the hope you've given them. People who want to tell you how learning about your compassion helped them find their own reasons to live. Sarah stared at the list, overwhelmed by the realization that her daily work had rippled outward to touch so many lives she had never known about. "There's one more thing," David said quietly, "something I've been waiting to tell you until tonight." He scrolled to a specific contact in his phone and showed Sarah a name that made her gasp. "Dr. Jennifer Collins, your sister?" David asked gently. Sarah nodded, confused. Jennifer was her older sister, a pediatric oncologist who lived in Seattle. They spoke regularly, but Jennifer had never mentioned knowing anything about Sarah's work at St. Mary's beyond the general updates Sarah shared during their weekly phone calls. "3 years ago, your sister contacted me through the hospital. She had heard about the letter-writing program and wanted to know if the nurse who had inspired it was named Sarah Collins. When I confirmed it was, she told me something that I think you should hear." David dialed Jennifer's number and put the phone on speaker. After 2 rings, a familiar voice answered. "David, is this the call? Is she finally ready to hear this?" "Hello, Jennifer," Sarah said, her voice barely above a whisper. "Sarah, oh my God, it's really happening. David, is she sitting down?" "I'm sitting down," Sarah confirmed, though she felt like the room was spinning around her. "Sarah, I need you to listen carefully. 5 years ago, I was going through the darkest period of my life. I had lost 3 patients in 1 month. Children who should have lived, who should have grown up and had families and careers and beautiful lives. I was questioning everything about my career, about my ability to help people, about whether the pain of caring for others was worth it." Sarah closed her eyes, remembering that period. Jennifer had seemed distant during their phone calls, but Sarah had attributed it to the normal stresses of her sister's demanding job. "I was seriously considering leaving medicine entirely. I was ready to give up on everything I had worked for. But then I heard about a program at St. Mary's Hospital where a man was writing letters to people in crisis, using the example of his night shift nurse to show them that compassion was real and worth believing in." Jennifer's voice grew stronger as she continued. "When I read those letters, when I learned about a nurse who stayed late to comfort frightened patients, who remembered birthdays and celebrated small victories, who treated every person with dignity regardless of their circumstances, I knew I was reading about my little sister. And I realized that if you could find meaning in caring for others night after night, year after year, then maybe I could find the strength to keep caring for my patients too." Sarah was crying again, but this time the tears felt different. Not just sadness or overwhelm, but a deep recognition of connections she had never imagined. "Sarah, you saved my career. You saved my ability to help children who are fighting for their lives. You reminded me why I became a doctor in the first place. And you did it without even knowing I needed saving." The conversation with Jennifer continued for another 20 minutes, with Sarah learning about how her example had indirectly influenced her sister's approach to pediatric care and her sister's decision to establish a compassionate care program at Seattle Children's Hospital. When the call ended, Sarah sat in David's room surrounded by the evidence of a decade's worth of influence she had never known she was having. The letters, the journal entries, the documentation of lives saved and hope restored, all of it stemming from a simple decision to show kindness to a stranger on her first night as a nurse. "David," Sarah said finally, "why did you wait 10 years to tell me about all this?" "Because I needed to be sure that the program was sustainable, that the impact was real, and that you were ready to step into a larger role. But mostly because I needed to be sure that I could give you something meaningful in return for what you gave me that night. You've already given me more than I could have imagined." "No, Sarah, I've given you the chance to see what you've been doing all along. Now I want to give you the opportunity to do it on a scale that matches the size of your heart." As dawn approached and Sarah's shift neared its end, she found herself sitting in David's room, surrounded by 10 years' worth of evidence that her work had mattered in ways she had never imagined. The letters from strangers, the documentation of lives saved, the journal entries recording small acts of kindness, all of it painted a picture of influence that extended far beyond the walls of St. Mary's Hospital. "David," Sarah said, carefully organizing the papers he had shown her, "I need to understand something. If you take this new position directing the Sarah Collins Center, what happens to you? Where will you live? Will you finally be able to leave the hospital?" David smiled, and for the first time in 10 years, Sarah saw something in his expression that she had never noticed before: anticipation for the future. "That's the final piece of news I've been waiting to share with you. 3 months ago, I was approved for a special apartment in the hospital's new independent living facility. It's designed for people who need minimal medical support but benefit from being close to healthcare services." He pointed to a folder Sarah hadn't noticed, filled with architectural plans and photographs of a small but comfortable apartment. "I'll be able to live independently for the first time in 10 years, but I'll still be close enough to continue the letter-writing program and to support the new center." Sarah studied the plans, seeing a 1-bedroom apartment with a kitchenette, a living area that could serve as an office, and large windows that would give David natural light for the first time since his accident. It looked like a real home, not a medical facility. "More importantly," David continued, "I'll finally be able to sleep at night, because I won't need to stay awake waiting for the right moment to tell you how much you've meant to me and to hundreds of other people." The weight of David's words settled over Sarah as she realized that his decade of insomnia hadn't been medical. It had been emotional. He had been staying awake every night, waiting for her, preparing for this conversation that would change both of their lives. "You really haven't slept in 10 years? "Not during your shifts. I couldn't risk missing the moment when you were ready to hear this story." Sarah shook her head in amazement. "David, that's incredibly touching. But you can't have spent 10 years sacrificing your sleep just to wait for the right time to offer me a job." "It wasn't a sacrifice, Sarah. It was a privilege. Every night, I got to witness compassion in action. I got to see you treat patients the way I needed to be treated on the worst night of my life. I got to document kindness and share it with people who had forgotten that kindness existed." David reached for one final folder, this one containing what appeared to be official documents from the hospital administration. "But if you're going to make a decision about the center, you should know exactly what you'd be taking on." The documents outlined a comprehensive program that would begin with training healthcare workers at St. Mary's in patient-centered care, but would eventually expand to other hospitals in the region. Sarah would be responsible for developing curriculum, training instructors, and overseeing the implementation of compassionate care protocols based on the model she had been unconsciously demonstrating for 10 years. "The salary is substantially more than what you're making now," David explained. "The hours would be traditional daytime hours, Monday through Friday. You'd have a staff of 3 initially, growing to 8 over the first 2 years, and you'd be working with hospital administrators, medical schools, and nursing programs to spread this approach to healthcare providers across the region. Sarah studied the job description, feeling simultaneously excited and terrified by the scope of what was being offered. David, I'm just a nurse. I don't have training in program development or curriculum design or administration. You have something more valuable than training. You have experience. You know what compassionate care looks like because you've been practicing it every day for 10 years. The administrative skills can be learned. The heart for this work can't be taught. David showed her testimonials from hospital administrators who had visited St. Mary's to observe her work, letters from medical students who had done rotations on her unit, and evaluations from supervisors who had been documenting her patient care approach without her knowledge. Sarah, you've been teaching people about compassionate care all along. You just weren't doing it formally. This position would simply give you the platform and resources to do intentionally what you've been doing naturally. As Sarah read through the materials, she found herself thinking about the night shift she would be finishing in a few hours, the routine she had followed for 10 years, the patients who had become familiar faces, the quiet hours between midnight and dawn when the hospital felt like a sanctuary from the chaos of the outside world. I love the night shift, she said quietly. I love the peace of it, the way you can really connect with patients when the world slows down. I'm not sure I'm ready to give that up. You wouldn't be giving it up entirely, David assured her. The center would include a component where you'd continue to do direct patient care, but as a mentor for new nurses rather than as their supervisor. You'd still be working with patients, but you'd also be teaching others how to work with patients the way you do. The idea was appealing, but Sarah still felt overwhelmed by the magnitude of the change being proposed. Can I have some time to think about it? Of course, but I hope you'll also let me introduce you to some of the people who want to thank you personally for the impact you've had on their lives. David scrolled through his phone again and showed Sarah a calendar filled with appointments, video calls with letter recipients who had requested the opportunity to speak with her, meetings with hospital administrators who wanted to discuss the center, and conferences where she had been invited to speak about compassionate care. All of these people are waiting to meet you, but only if you're ready, only if you want to see the full scope of what your kindness has accomplished. Sarah looked at the calendar, seeing names and locations from across the country. People in California, New York, Florida, Texas, all connected by letters David had written, inspired by her example, now hoping to meet the nurse who had unknowingly helped save their lives. There's one appointment I particularly hope you'll accept, David said, highlighting a video call scheduled for the following week. Her name is Maria Santos. She's a mother of 3 in Arizona who wrote to me 4 years ago when she was planning to end her life after losing her job and facing eviction. I wrote back to her about a nurse I knew who treated every person with dignity, regardless of their circumstances. Maria decided to seek help instead of giving up. She's now a certified nursing assistant, and she credits her decision to enter healthcare to learning about your example of what caring for others could look like. Sarah stared at the calendar entry, overwhelmed by the thought that someone she had never met had chosen to become a healthcare worker because of stories David had told about her approach to nursing. She wants to thank you personally, David continued, and to tell you about the patients she's been able to help because she learned from your example what it means to see the humanity in every person she cares for. The morning light was beginning to filter through the windows of room 237 as Sarah considered everything David had told her. Her shift was nearly over, and soon the day shift nurses would arrive to take over patient care. But for the first time in 10 years, the end of her shift felt like the beginning of something new rather than simply the completion of another routine night. David, Sarah said finally, if I take this position, what happens to us? Will you still be my patient, or will our relationship change completely? David smiled, and Sarah realized it was the first time she had ever seen him look truly at peace. That's entirely up to you, but I hope we'll be colleagues now, working together to help other people find the kind of healing we've both experienced. Both experienced? Sarah, you saved my life 10 years ago, but you've been healing too. I've watched you grow from a nervous new nurse into someone who has found deep meaning in caring for others. You've discovered that your work matters, that you have gifts worth sharing, that you can make a difference in the world through simple acts of daily compassion. David was right. Looking back over the past decade, Sarah could see how much she had grown, how much confidence she had gained, how much purpose she had found in her work. The scared young woman who had started her first shift 10 years ago had evolved into someone who truly understood the healing power of human connection. "I need to finish my shift," Sarah said, standing up but not moving toward the door. "But David, I want you to know that even if I decide not to take the position, learning about all of this has already changed my life. Knowing that my work has mattered to you and to all these other people, it's the most meaningful thing anyone has ever told me. The work mattered because you did it with love," David replied. "That's what I've been trying to tell people in crisis for 10 years, that there are individuals in the world who choose love over indifference, who see value in every human life, who show up consistently to care for others. You've been my proof that such people exist." As Sarah reached the door, she turned back one more time. "David, will you finally be able to sleep tonight?" "I think so," he said, settling back against his pillows with a contentment she had never seen in him before. "For the first time in 10 years, I think I'll be able to sleep peacefully, knowing that the story I've been waiting to tell has finally been told." Sarah Collins stood in the parking lot of St. Mary's Hospital at 7:30 a.m., watching the sunrise paint the sky in shades of pink and gold. In her hands, she held David's leather journal and the folder containing the job offer that would change the trajectory of her career. Her car sat a few feet away, waiting to take her home to the apartment where she would usually sleep until late afternoon before beginning another night shift. But instead of driving home, Sarah found herself walking back toward the hospital entrance. There was something she needed to do before she could rest, something she needed to see with her own eyes. She took the elevator to the 3rd floor and walked quietly through the corridors that had been her domain for 10 years. The day shift was in full swing now. Doctors making rounds, nurses administering medications, visitors arriving to check on family members. The hospital felt different during the day. Busier and brighter, but no less purposeful than it did during her quiet night hours. Sarah paused outside room 237 and peered through the partially open door. David was asleep, truly asleep, for the first time since she had known him. His face was relaxed, peaceful, free of the watchful alertness that had characterized their 10-year relationship. On his bedside table, Sarah could see the manila folders organized and ready, as if he had finally completed a project that had taken a decade to finish. As she stood in the doorway, Sarah became aware of someone approaching from behind her. She turned to see Dr. Martinez, the head of the psychiatry department, walking toward her with a warm smile. "Nurse Collins," he said quietly, joining her in the doorway. "I hear congratulations are in order. David told me he was finally going to explain everything to you last night." "Dr. Martinez, did you know about the letters, about the program, about everything?" "I've known for several years," he confirmed. "David asked for my help in formalizing his correspondence program, and once I learned about the impact he was having, I couldn't help but support it. But I also knew that the real story wasn't about David's letters. It was about the nurse who had inspired them." Sarah looked back at David's sleeping form, still amazed by everything she had learned. "He stayed awake for 10 years waiting to tell me this. He stayed awake for 10 years documenting compassion in action," Dr. Martinez corrected gently. "You've been teaching all of us about patient care, Sarah. We've just been waiting for the right moment to let you know we were paying attention." As they walked away from room 237, Dr. Martinez told Sarah about other changes that were coming to St. Mary's. Improvements to patient care protocols that had been developed based on observations of her work. Training programs for new nurses that incorporated her approach to bedside manner, and research studies that would document the impact of compassionate care on patient outcomes. "Sarah, you've been practicing evidence-based medicine without realizing it. The evidence you've been creating is that kindness heals, that patients recover better when they feel seen and valued, that healthcare workers find more meaning in their jobs when they focus on human connection alongside medical treatment. When Sarah finally left the hospital that morning, she had a different understanding of her 10 years as a night shift nurse. What she had thought of as simple routine work had been something much more significant, a daily practice of compassion that had rippled outward to touch hundreds of lives across the country. 3 weeks later, Sarah Collins accepted the position as director of the Sarah Collins Center for Compassionate Care. On her first day in her new role, she received a package from David Chen, who had moved into his apartment in the hospital's independent living facility. Inside the package was a new leather journal, identical to the one he had kept for 10 years, along with a note for documenting the next chapter of the story. I can't wait to see what compassion looks like when it's given the resources and platform it deserves. The journal's first entry, written in Sarah's careful handwriting, read, Day 1 of the Sarah Collins Center. Today, I learned that sometimes the most important work we do is the work we don't realize we're doing. Today, I discovered that kindness is not just a nice gesture. It's a form of medicine that can heal both the giver and the receiver. Today, I begin the work of teaching others what David taught me, that every human interaction is an opportunity to choose love over indifference, and that choice can literally save lives. 6 months after the center opened, David Chen received a letter from a young nursing student in California who had heard Sarah speak at a healthcare conference. The letter thanked him for creating the program that had helped the student understand that nursing was not just about medical procedures, but about seeing the humanity in every patient. David smiled as he read the letter, then reached for his computer to begin his response. After 10 years of correspondence, he had learned that the best stories are the ones that inspire other people to write their own. And in room 237, now occupied by a new patient who benefited from the compassionate care protocols Sarah had helped develop, the night shift continued. The same quiet hours, the same dedication to healing, the same choice to see dignity in every person who needed care. The only difference was that now, everyone understood that what happened in those quiet hours between midnight and dawn was not just healthcare. It was love in action, one patient at a time.